Good evening, everyone.
Hello.
I'm going to share my screen. Perfect. Okay, so today we're talking about 3 simple tricks for baby. I'm Dr. Royer. As you know, this is Dr. Ralph. Thank you for joining us. We're going to talk about just 3 simple things that can make a huge difference for baby's spinal health. First one is the rolling diaper change. So typically most parents will grab babies by the ankle and lift towards their head to take out the old diaper, to wipe and whatnot. We would advise that we change that up as that adds extra stress, especially to the centers of the spine that are responsible for digestion, elimination, and gas. So instead of doing it like that, what we want you to do is roll baby one way. This is one of our cuties. Roll one way, obviously taking the diaper off, wipe, roll the other way, wipe, and then do the same motions to place the new diaper under the baby's bum. So you want to make sure that you're rolling them all the way sideways. Our little model wasn't 1,000% doll-like, but you know, that's life. So you want to make sure that they're not twisted as much as possible. And again, you just want to be gently doing these motions. You don't want to really be forcing them. Baby is going to squirm around a little bit, but don't worry too much about that. Second is a lot of times baby looks like they're struggling to poop or to pass some gas. They look a little uncomfortable. And what you can do in order to aid elimination of that gas, get things moving around in baby's tummy, and get some, poop moving, is the rainbow tummy massage. So it's called the rainbow because it's just in the rainbow arc. It's basically an upside down U in a clockwise motion on the baby's stomach. And the clockwise motion is very important as that is the direction of the actual colon. And so we want to be moving poop out and gas out and not back in. Okay, you want to use a gentle but firm enough pressure. You want to be sweeping all the way. You can use some lotion or coconut oil. You can even do it over clothing if that, in a pinch. And you only want to be doing it about 6 to 8 times and then rest. Okay, give it a minute, give it a couple minutes, 10, 15, and then if nothing happens, maybe do it again. But don't constantly be doing it until baby does something. So you want to not do this right after baby eats, as that can cause some spitting up. And if you, get a poop or 2, then woohoo, it worked. Okay, and Dr. Ralph's going to do the third one.
Yes. So it's very important to help them pass gas for that belly massage. Just before I go to this cross crawl, as Dr. Royer was mentioning, things you might notice baby doing. If they're clenching and they're very tight, they're always trying to bring their knees to their chest or just extending quite a bit. They might have some built up pressure, some gas that needs to be released. It might be something to definitely look at the nerve supply to that area. So definitely consulting with a chiropractor that can check out your little ones that you feel comfortable with. But also in addition to that, you can definitely do the belly massage that will help to encourage them to pass that gas. Because also, if you think about it, babies don't have the core stability that most of us should have to work the gas and the poop through. So that just kind of helps to aid them. That's kind of like their 6-pack, work it through. Okay. So moving on to this cross crawl exercise, it's so important for babies to reach their developmental milestones, lifting their head up, going on their forearms, and then getting that crawl pattern. So sometimes you see when babies are scooching on one side of the army crawl, they're not bringing their legs up or anything like that. We want to start to encourage them to help to build that developmental pathway neurologically with that opposite leg to opposite arm. Okay. And so these little stretches right here will help to do that, encouraging that motion for them, setting up those neurological synapses for them to start developing that pattern. So it's easier for them once they are able to go on their stomach, get up on their forearms and knees to start doing that cross crawl pattern. So this little exercise, just you want to have them on their back, making it fun. You don't want to force them into anything that they're not going to feel comfortable with. So just making it a fun game, bringing their left arm to the right arm, making it fun, laughing, giggling in between, and then do that a couple times, 5 times of each side, and then switch the other side. And you can do this a few times a day, and they usually love it. It's a pretty fun game for them.
All right, so that's about it. There are, it is always a good idea. Birth alone is a good reason to get your baby checked. There's lots of forces and lots of pressure on baby. And, just to be clear, we do check babies here. Myself, Dr. Ralph, and Dr. T, they're probably, don't tell anyone, but our favorite patients. There are a few reasons or a few things that you might not necessarily think of as a chiropractic problem, but like Dr. Ralph said, being really tense and tight and not having just like a relaxed tone could be something that you want to get your baby checked. Difficulty sleeping, obviously a few of the more common known things for babies are colic, ear infections, but things even like spitting up, help with teething. Like I said, sleeping's huge. Either napping, not napping during the day, not being able to self-soothe at night, or sleeping through, obviously depending on how old they are. But those are also some things that you might want to consider bringing in your baby if you find that they're having issues with those sorts of things. I'm not sure if Dr. Ralph has a few other ones, but I think that's about it. Sleep, spitting up.
If you're noticing that, they're in the crawl phase and they're doing, the army crawl or the gorilla crawl across the room with one arm, it might be something misaligned in their pelvis too. So it's definitely a good idea to get that checked out. Things like even, tippy toe walking consistently, it might be something to look at their nervous system, how that's functioning too. So chiropractic might be able to help with that as well.
And the main premise of chiropractic is connect your brain to your body so your body knows what to do. So it's obviously really important for babies. You can always call and have a consult with us. Number here on the screen. We can do it over the phone. We can do it on a Zoom. We can do it in person if it's friends or family that they don't necessarily not quite comfortable. We can always just have a quick little chat before we bring them in. We do use our computerized technology to scan the babies as well, checking to see the status of, how hot the nervous system is, if it's running too much or not enough. So that's available for babies as well. So that gives us a really good idea of what exactly is going on with your baby or your friend's baby. So I hope you enjoyed this video. It's a little bit shorter than our normal ones, which we're going to try to keep a little bit shorter in the coming months ahead. You'll always be able to access our videos on our YouTube channel. And if you have any questions or comments or whatnot, you can even post them in those right on YouTube, and we'll reply to you as well. We will be sending this out to anybody who requests. And you can always email us for that information too. All right.
Thanks, guys.
Have a great evening. Thank you so much for your time. Bye.